Welcome to Plastic Surgery TNA. I am your host, Dr. Earl Stephenson Jr., board certified plastic surgeon here in Atlanta, Georgia, and owner of ESJ Aesthetics here in Dunwoody, Georgia, a northern suburb of Atlanta. Merry Christmas. Happy New Year. And I wanted to thank anyone who has followed me for the year and watched these videos. I appreciate your support. If you are new to this platform, welcome. I will ask you to do the typical things if you wouldn't mind. If you wouldn't mind, give me a little early Christmas present and like, share, or subscribe. Really appreciate that. Every week I try to put together information or content that I think will be helpful or useful. This is truth and transformation. This is what I'm about. And every year, at the end of the year, there are all kinds of articles, videos, talking heads, such as myself, talking about the trends for the next year. So, the trends for 2025. And in my research, it's the same stuff. It's just repackaged and talked about differently, relabeled, reworded. There's really nothing that I found thus far in my research that is novel or new. But there was something interesting that I found. In the past, we've talked about mommy makeovers. We've talked about daddy do-overs. We've talked even about menopause makeovers. But what's buzzing for 2025 is the Ozempic makeover. And as you guys know, Ozempic has blown up. People are trying to acquire it. Many people have it. Many people have used it and have lost a tremendous amount of weight. And this is, an explosion of people who are getting healthier, which first and foremost is fantastic. But they're having to deal with the consequences if they lose significant amounts of weight, 50, 60, 100, 150 pounds. And we've got a really large, I hate to use this term, volume of new clients that may seek our services. Unlike when there was a revolution in weight reduction surgery, yes, we had a bump in those clients, but not to the if level of what we're seeing and will continue to see from weight loss medications, GLP-1 medications, such as semaglutide. So, with that being said, there are all kinds of articles popping up about the Ozempic makeover. So, first, we need to understand a couple of things. What I want to do in this podcast is talk briefly about the GLP-1 medications. I'm no expert. I do have some general understanding, but I want to talk a little bit about that to kind of help you understand how those things work and what the effects are. Number two, what I want to talk about is the bodily effects once you've lost that weight of those medications. And then number three, I want to talk about what I can do for those areas that you've lost volume and want to address. And then lastly, if you're on this path and you're trying to build your summer body this winter, then I'll tell you just a couple of little tidbits of when you're ready to make that move. So, with that being said, let's talk about the GLP-1 medications. So, obviously, we know what they do in total. They help people lose weight, but really they were built for people who have type 2 diabetes. And in this type of diabetes, it's not that you need insulin. Your body produces insulin, but it doesn't produce enough to bring down your blood sugars appropriately. So you have high blood sugars. This leads to a cascade of increased weight gain, increased, you know, heart effects in the form of more resistance. The heart has to work harder. It increases your cholesterol and fat levels, which then line the arteries that are the highways and byways for nutrition and blood flow to organs, which makes that very difficult. So it's really, really important to understand what the GLP medications do for type 2 diabetes, and as a consequence, what the results are. So, what these medications do is replace a normally produced hormone in the body. Bring up this when you have food intake, the food triggers release of GLP-1 hormones in your body. These hormones are responsible for decreasing your appetite so that you don't overeat. It works at the brain level. So you just go, man, whew, I'm stuffed. So that you just don't keep piling it in. They also stimulate the pancreas, which sits in the middle of your tummy. And you should never be aware of your pancreas. You never want to be aware of the pancreas. But these hormones stimulate the pancreas to produce insulin with the intake of food, so that that food, which is turned into glucose or sugar, is coupled with the insulin and driven into cells that need the insulin, need the glucose or sugar for energy. It also slows down stomach emptying so that it's a little bit more subtle as you kind of get your food. It's not a wave or a rush. So that tends to make you feel full faster and tends to make you feel satisfied longer. But it also inhibits a stress hormone called glucagon, which glucagon liberates stored sugars or glucose so that it can be those sugars can be dumped into your bloodstream in case you needed it. So it inhibits that. So when you have a decrease in this naturally occurring hormone, you get the opposite effects. You get your brain never telling you you're full. You get the pancreas never really getting stimulated to produce enough insulin to help drive down blood sugar. Your stomach empties really rapidly and you feel, hungry again. It doesn't inhibit that stress hormone, glucagon. So now glucagon is working on your stores of sugars, particularly in the liver. And now you've got more sugar in your blood system, which has detrimental effects. So when we add these medications from outside of the body, via shot typically in your tummy, in your upper arm, or in your thigh, then we enhance or these properties of the naturally occurring hormone. And with that happening, you just feel less full, you feel more full for longer. You have a decrease in your appetite to a reasonable level, and you have less food intake, coupled with, and this is important, coupled with exercise and a reasonable eating routine. I hate the word diet because diet seems to be kind of faddish. I'm going to try this for X amount of days, X amount of weeks. These are lifestyle changes. With that, you get weight loss. Also, you decrease in bad cholesterols and lipids or fats, which can line your arteries with plaques and close them down. So it makes it harder to get blood out to the organs for their health, blood up to the brain for its health organ, blood back to the heart, which needs blood as well. So because it pumps everything out, which puts you at risk for increased blood pressure and the effects of that damaging of the heart muscle, possibly stroke, even damaging of the heart muscle to the point where you have a heart attack. So these medications are really, really significant. And so they really have helped type 1 diabetics, but they've helped people who don't typically have type 1 diabetes, but maybe they border it. Maybe they have definitely some insulin resistance. I know in men, and I will probably echo that based on what I've seen in women. When that happens, you carry a lot of weight in your midsection. You just, no matter how much you exercise, how great you're doing on a lifestyle style change on your food intake, meal prepping, what have you, you just can't get rid of that. This may be some form of insulin resistance. There's some other signs, such as in people of color, especially darkening of certain areas of their skin, uh, that can lead to that kind of diagnosis. But you just can't lose that midsection fullness. These medications help with that, and they help obviously, reduce fat in other areas. So this leads to a loss of volume. And this was kind of talked about, I guess, probably last year, maybe in the year before, about the Ozempic face, where you have these really gaunt looking faces. They just have lost all the fat in their face and have droopiness. And so that Ozempic face really took off, and people start to address that with various treatments. We'll talk about that here in a minute. But now this is kind of expanded to talk about, other body parts that are affected by loss of volume, and then most importantly, loss of skin laxity, especially if you're losing a significant amount of weight. Again, 70, 100, 120 pounds. The skin has been stretched out for so long, even though you've lost that weight, and you may have done it even deliberately, that skin cannot contract back to your core. And so you have what I call the stigmata or fallout from these medications. You have laxity of your jaws, laxity in your neck. You have basically hollowing of the cheeks. You have looseness of the skin of your arm. You have droopy breast. And this is for men and women. You have excess skin of your tummy, excess skin of your thighs, drooping of your buttocks, loss of volume of your buttocks, extra skin of your back. Again, you have lost the weight, you're feeling better, you're doing better. In a sense, you're looking better, but you still have these areas that need to be addressed because outside of clothing, even if you're wearing a bathing suit or skin or swim trunks, then you have this excess skin that you have to deal with. So, how do you deal with that? What do you do about that? Once you've reached that weight goal, what do you do? Well, obviously, most people think of, I'm going to go to the plastic surgeon. Of course, that's what you do if you want to address those things. It's going to be hard to address skin tightening in the gym. It's just not going to happen. Certain rub ons, certain diets, or excuse me, food trends are not going to tighten up your skin. You're going to have to make a decision in your mind. If the skin is enough to bother you on a daily basis, am I comfortable with seeing a plastic surgeon and having this addressed? That's the first decision you have to make to move you forward. And it's okay to see a plastic surgeon. Let me talk about the psychology of this just for a second. Because in general, people get kind of freaked out. Well, I don't want to be vain. I don't, you want to be the best version of yourself that you can be. If you can achieve that without plastic surgery, so be it. If you need plastic surgery, it's okay. It's all right. So, with that being said, the research that I looked at or kind of tuned into, they broke it down into minimal things that you can do to kind of help this loss of volume and excess skin, surgical things that you can do. Okay, fair enough. So, what are some of the minimal things you can do if you're a candidate? Let's say you didn't lose 70 pounds, 120 pounds. Let's say you lost 35 pounds. You've got a little excess skin of your neck. You've got a little excess skin of your arm, and maybe even just a little excess skin of your tummy. There are technologies out there that have been out there forever, but they've been tweaked and tweaked and tweaked and tweaked where they've been better and gotten better outcomes, more predictable outcomes. And those are radio frequency treatments. And I would say the latest version of that, as I sit up here, let me take a drink. It's on the struggle bus for a second. That's why I was skirting. But the latest version of RF or radio frequency treatments is called, or proprietarily called, face tight and body tight. And what this does, it takes energy and it places the energy at the level beneath the skin where the fat lives. This is through a small incision. You know, thoughtfully placed in the face, neck, arm, tummy, what have you. And this energy is delivered to melt fat if there's some remaining, and to stimulate collagen to shrink. And that gives you a tightness and firmness that you can achieve without surgery, and then you can't achieve by going to the gym. So this is done. It can be done in the office, can be done under, sedation, or it definitely can be done in the operating room in conjunction with other things, of course, or by itself. Here's a picture of a patient, not my patient, who is having an RF treatment for probably jaws and lower face. This is something that can be done very quickly in the, again, operating room or in your office. And the results are really, really pretty good. Pretty good. Like any other surgery or any other procedure, you have to pick the right candidate. You can even, in conjunction with this RF treatment, and I'm gonna clue in on face, you can add volume with fat grafting if the patient has some fat left to help that, or with traditional fillers such as Juvederm for under eye hollow or Voluma for cheek. You can definitely do those treatments as well. So those are types of minimally invasive makeovers that you can have. Obviously, you can't put fillers in the arm. Or people haven't done that, but you can use RF in the arm. You can use RF in the tummy to help tighten up. And people are obviously not putting fillers or fat in the tummy. You can even use minimally invasive techniques, not RF, on the buttocks. It's going to be hard to put fat there, but people use sculpture, which is a biologic stimulator of collagen to help plump up the buttocks. So you can definitely use that. So those are some minimally invasive techniques for clients that can potentially use a little sprucing up of their volume and tightening of their skin. Typically, I think if you divide patients in half, or say you're going to either go minimally invasive makeover or surgical makeover, I think most people are going to end up in the surgical end. That's just my experience and just my thought based on my experience. So, jumping from that to surgical interventions, what can you do? For the face, you certainly can go back to the RF, but that's going to be in conjunction with a facelift, which can be in conjunction with an eyelid lift or a brow lift at the same time, where you get around the ear, underneath the skin. This is a schematic of a deep plane facelift, which is a composite facelift, which is the old term, which really gives you maximum lift, removal of the excess skin. And then you can use RF in various areas to kind of tighten and help improve your results. So definitely a facelift for people who have tremendous laxity and volume issues of the face and neck. So that's what you're going to have surgically if you have that significant laxity in those areas. If you have laxity in your arms that's significant, where you don't have fat anymore, so you can't liposuction it. It's too much skin, or you've got a bat wing, which is it's commonly or affectionately referred to, then RF is not going to tighten it up significantly. Then you're going to need an arm lift, which is provided under general anesthetic typically, and is a removal of this excess skin and contouring the arm so that it looks like it does below in the after. Illustration. You can use RF in conjunction to this. You may even use some judicious liposuction if you think you need it to affect this. Brachioplasties usually heal within 6 weeks, meaning you can get back to your normal activity. But the final results, the final contouring, the final quote, feeling more like yourself really may take 6 months or more. So, but it's a really nice procedure. And if it's expertly done, in my opinion, it can give you a great result. Definitely give you a great result. The things I try to do differently than this illustration is I try not to leave that incision kind of in this arm area. Let me take this down so you can see me. I try not to leave that incision right where this seam is, the seam of my compression or workout shirt. I try to leave my incision back here because when women, particularly, want to wear something sleeveless, they're talking with their hands and they don't want to really see an incision here. When you're talking and facing people and using your hands, the incision back here is rarely seen. Now, if somebody's behind you, they can see it. We just can't get rid of it. We're not magicians. But no longer placing the incision here, but placing the incision there. So an arm lift definitely is a great procedure if you have a bat wing. You can use RF with it. You can use a little liposuction with it, but providing an arm lift procedure is life altering. So that's how I would address the arms. What if you have saggy breast? Then a breast lift is going to be the best solution for that. Don't know anybody doing RF on breast. Never heard of that. I could be challenged. Anybody out there want to leave a comment? Any surgeons who may run upon this and you're doing that, then let me know. I'm not aware of it. But traditional breast lift methods work the best. You can have a donut lift, you can have a lollipop lift, or you can have an anchor lift. Typically, again, as I educate my clients, typically, if we want to really make a pop, make things work. We've got to kind of settle in with that anchor lift. We got to get comfortable with it. That's going to give you the most power, the best result, in my opinion. You can couple that with an implant if necessary, if you want the lift, but still want either equal volume that you had prior at your more healthy weight prior to weight gain, or if you just never had volume and you want volume, you certainly can add an implant with a lift. I think this is pretty straightforward. This is nothing different. There's nothing magic about whether this weight loss came from gastric surgery, just a complete dedication to a lifestyle change only, or this is from a GLP-1 medication. It's still, massive weight loss type of procedure where we do a breast lift plus or minus an implant. New news there. So moving forward, if you lose a significant amount of weight and you've just got these back rolls, which, you know, women really hate, it just bulges over their bra. When they try to wear something contouring, you can see it. They have to wear compression type garments of torture. You can do a back lift or upper body lift or bra lift. Those are some of the terms that have been used. And this is definitely done on general anesthesia. As you can see, it just gets rid of, if you want this area smooth, you just got to get rid of this excess skin. And you have to accept that you're going to have a healed incision along your bra line, and that will run to the side. And what I try to do is I try to do this in stages. If a lady or a guy has problems with their breast or chest, I do that typically first because I think that makes the most impact psychologically. And then we wait maybe 6 months or longer. And then we come back and do the back. And so that the incision on the side then can be carried around so it's at the same level all the way around to take care of the upper body lift. What I try not to do is to have an incision that's kind of coming around from the front, from chest work or breast work to the side of the chest, that is at a different level than the body lift, upper body lift incision. We want to make sure that those two are married. So, upper body lift is a very powerful procedure. Uh, Done many of these as well. It really works super well, but you gotta, as the client, wrap your mind around that you're going to have a healed incision of your upper back. That's the trade off. So, again, nothing new, just this is what we can do for people who are taking semaglutide or GLP-1 medications and have met their goal weight. Tummy. So I would say probably between breast and tummy, these are the two most common weight loss procedures. Uh, if you wanted to break it down between tummy and breast specifically, I would say, in my experience, people opt for tummy first because they want to have that. Women, let's be specific, want to have that shapely tummy, that small waist. They want to be snatched, all the words that you can use. And so, yes, do traditional tummy tuck um, measures work? Absolutely. It depends on how much skin that you have that is lax. Usually in a traditional tummy tuck, you have skin. Take this down for a second. You have skin that's, and I'm gonna go up high, but if you imagine if I were down by my legs or pubic area, you have skin that's lax in this direction. So you take out the excess skin and you pull it down and tighten it up. But you can also have skin that's lax in this direction. And so, as a seasoned plastic surgeon, you need to be able to identify all the, they'll use a fancy word, vectors or directions of laxity and address those. So, yes, can you have a traditional tummy tuck where you take away the excess fat and skin of this area above the muscle, leaving the belly button or the navel as the natural navel down and attached to the client or patient, and then tighten these separated muscles as you see here, and then remove the excess skin and then sew things up? Absolutely. But if someone has excess skin in the side to side direction, as you can see in this little picture here, they talk about a vertical incision if needed. You may need that vertical incision to go all the way up to just below your breastbone. And that type of tummy tuck is called a, if I may use my French, a fleur de lis, and that means flower in French. And it is an inverted T type of incision to give you the contour that you want. If you have significant laxity in that side to side direction and you don't do that, you're still going to have kind of loose skin, even though you're tightened below. So it's really crucial for your plastic surgeon to recognize these directions of laxity and for you to be accepting. If you really want the contour that you desire, then you have to be accepting of these healed incisions. So again, great operation. One of my favorite operations is a tummy tuck. It just on the table when you start and at the end just gives me such gratification, and it gives my clients such gratification. I really enjoy this operation. It can be coupled with breast work. I probably would do that. I probably wouldn't couple arm, breast, and tummy together routinely. There are outlying circumstances where that can work, but routinely I wouldn't do that. I would stick to probably two areas for many reasons. Uh, professionally and personally. I got to know myself and what I'm capable of doing effectively, efficiently, with great predictable results. So, tummy tuck, traditional tummy tuck, fleur de lis, are powerful, powerful, powerful procedures. Lastly, maybe it's not your tummy. Maybe your butt is sagging. You notice that you're just got a saggy butt. You can't do enough squats. You can't do enough lunges. You can't do enough whatever to plump things up. And your thighs are saggy. You know, you can do a lower body lift. Again, typically it can be circumferential. So you can kind of combine a tummy tuck type procedure in the front and an removal of skin and a buttocks lift in the back as one procedure, or you can stage it. You can do the tummy first. I'll just go with that. Get that healed, come back 6 months later or so, and do the butt lift. Again, making sure those incisions from front to back are at the same level. And voila, you have kind of accomplished the lower body lift. But these days, most plastic surgeons who do a significant volume of these cases will do uh, this circumferentially or all at one time. It's not a problem. Just got to plan for it, just like anything else. So this is an effective, definitely, procedure for the tummy. As we can see, again, it's a version of a tummy tuck, if I can use that, but we can definitely lift the buttocks. So you can kind of use the patient's own excess skin underneath the skin of the lifted buttocks to give more volume. If you have some fat, you can also use some fat. I'm sure my colleagues kind of push the envelope and do buttocks implants at the same time as this. I don't do that. I'm not, buttocks implants in my hands early on just led to a lot of problems. So I don't really do that. There are people who are really, really plastic surgeons who are really, really phenomenal at that. So just choose your plastic surgeon wisely if that's the route you want to take or the route that's been recommended. So lower body lift definitely addresses the outside thigh. It can lift that as well. It doesn't really address the inner thigh. I don't really have a visual of that, but the inner thigh is almost like removing skin in a crease of a pants or seam of a pants, rather. Uh, Again, it's not the greatest incision if you want to be kind of covert about having things done, be able to be covered up with clothing that is a little bit more revealing. What I mean, if you wear shorts, you're going to see your incision that comes down to the inside of your knee. If you're willing to accept that, then that's fine. Uh, some people are not willing to accept that. So a lower body lift will address buttocks, tummy, outer thigh, but not inner thigh. Inner thigh can be addressed in a separate procedure called inner thigh lift. And again, that typically is done like a seam of a pant. Sometimes it can be done kind of up on the thigh underneath the groin. But what I found is when you kind of move that thigh skin up and remove it, that and put it in that V-like groin crease, that scar over time, because that skin is heavy, will drift down, 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 down. And now where you had a healed incision and hidden in that groin vertical or diagonal groin crease, you've got a diagonal scar kind of in the upper third of your thigh. So, it's not really aesthetic. Some docs have just decided to start there. They just do it there. We just put the scar. If you look to the diagram on the left, just kind of where that shadow is of the crease near the groin, that white line, that line of reflection. Some people just put an incision there and say that's where we're going to start because if I put it in the groin crease, that's where we're going to end up anyway. So I'll just start there. Again, you've got to talk to the client. They've got to be accepting of this. They got to know the expectations. So it's really, really important. So those are the surgical kind of arms of what you can do. We talked about the GLP-1 medications producing weight loss as a result, resulting in loss of volume, resulting in increased laxity or loose skin, and you can address that minimally. If you have, minimal weight loss, it could be, radio frequency, the face, maybe fillers, uh, either fat if they have any, or dermal fillers such as Juvederm, Restylane, so on and so forth. You can use radio frequency in the tummy, arm. If there's just a little laxity for your buttocks, if you got a little droop, you can use biostimulators like Sculptra. So those are minimally invasive makeovers. People tend to have more dramatic laxity of skin, so they tend to fall in the surgical arm of this. So the Ozempic makeovers per se can include facelift, plus or minus radio frequency. You can always add a bleph if necessary. You can always add a brow lift if necessary. You also neck lift as well. For arms, you're going to add an arm lift or brachioplasty, plus or minus radio frequency, maybe liposuction if there's minimal amounts of fat that need to be contoured. For breasts, for women, you're going to do a breast lift plus or minus an implant. For men, you're going to do a gynecomastia surgery, most likely an incisional surgery. So you put the scar down where the natural crease of the pectoralis major muscle is, and then replant the nipples and areolar in a more manly position, masculine position. So that's what you would do for that. For upper back rolls, you're going to do a upper body lift or a bra lift for women. Again, very powerful procedure for tummy, men and women. You're going to do a tummy tuck. Uh, if there is laxity of the skin in two directions, side to side, and then up and down, then you may have to have a fleur de lis, which is an inverted T type of tummy tuck. But again, very powerful. You have to wrap your mind around that healed incision that's up and down. And then lastly, you can have a lower body lift, which will address saggy buttocks or booty. You can address the outside of the thigh. You can address the tummy as well if you do it circumferentially. So those are the makeovers. Now, is this anything new? Have we been doing these things? Absolutely. We've been doing these things for massive weight loss from, again, people just changing their lifestyle with nothing else. We've been doing this from people who've had massive weight loss after bariatric surgery. We just have a new, I guess, flow of clients coming from using these GLP-1 medications. And they just happen to come from these medications. So we call it an Ozempic makeover. Still the same procedures, but just applied to a new stream of clients. So, I mean, that's marketing 101. So, what can I say? That's a trend that I think we as plastic surgeons will see. We'll just get a bump in potential clients because of these medications. These medications are phenomenal in helping people with type 2 diabetes and people with insulin resistance, either known or unknown. It helps you change the brain chemistry so you feel fuller, you don't overeat. I think we as Americans overeat, and it helps your cardiovascular system from the stress and strain of carrying excess weight. What can I say? All right. So, all these things to do. You maybe are in the process of using semaglutide, or whatever other GLP-1 medications are out there, and you're looking at yourself and you're proud, or you're going to start and you want to make sure that you have all your bases covered. Hope this has been helpful to know that if you get to the end of the weight loss, and you have excess skin or loss of volume, that this can be addressed. And it's okay to see a plastic surgeon if you can address it any other way. And typically you can if you have significant volume loss and skin loss, a skin laxity. So how do you know you're ready? You've gone through the trials and tribulations. You've worked down the pathway. You've lost your weight. When are you ready for your aesthetic surgery? It's just two simple things, in my opinion, as a primary indicator if you're ready. And it's nothing different. You need to have met your weight loss goals. Now, you can meet with me, while you're in the midst of your weight loss goals just to see where you are as far as what you may need. People come in for, just a trial and error to kind of try on the plastic surgeon, see if they mesh with them. And so that when they get to the end of the journey, they know who they want to have, work done by. Or you can just kind of come out and get information and say, I don't know what may happen. What are the possibilities? And of course, people want pricing. That's okay. But you have to get to the journey at the end of the journey, and you have to be finished. If you it's in my opinion unwise if you haven't met your goal weight to have your surgery, because then that will affect the outcome. And then on that same note, once you've met your goal weight, it needs to be kind of stable. You can't just, be someone who may flip flop back and forth. You've got to maintain the other things because you're probably not and probably shouldn't be on GLP medications forever. It's a boost and an aid to help you and help the brain think differently about food, help your body regulate food differently. You modify it by modifying what you take in and the quality you take in, and you exercise and you keep those arms of this process moving forward forever, which will require less or no GLP-1 medication at some point. But you got to be stable moving forward. 6 months is reasonable. Obviously, once you're stable, met your goal weight, you want to make sure that you're healthy. You have control of your health, and are a good candidate in that standpoint. Doesn't mean you don't have to have any medical illnesses. I'm not saying that. People who have blood pressure issues, even despite doing all the right things, and they are managed adequately under a physician's care, then you can have this done. Uh, Again, just as an example. So you want to make sure that you're good medical stability, good weight stability, and you've met your goal weight. And you have to have realistic expectations about having aesthetic surgery because it is a real procedure. It's not, and I don't mean this disparaging, it's not getting your nails done, it's not popping over and having something done over the weekend or over the lunchtime. This is real surgery that you have to prepare for psychologically, logistically, with your home, your plus one, your family, your husband, wife, financially, and from a psychological standpoint and physical standpoint of healing and getting back to your life post GLP-1 weight loss and aesthetic plastic surgery contouring. So, with that being said, I hope that you guys enjoyed this. If you have any questions, leave them in the comments below. I do check back. If you just want to email a comment to me, you certainly can do that. You can email me at concierge at ESJ Aesthetics, or you can just contact us through the website, contact us tab at www.esjaesthetics.com. You certainly can call the office, schedule an appointment. Be happy to sit down with you. As I said at the beginning of this, I have a boutique practice. I've been practicing nearly 20 years. I've had the big practice, couple doctors, lots of patients. I've had this solo practice, lots of patients a day. Now I have a boutique practice that focuses on you. Your time is precious and valuable. We're not hurried. We want you to feel good about your experience. And so be happy to sit with you if you call and make a consultation. I will be upfront, transparent. Consultations cost. You wouldn't want to get paid for your time, not get paid for your time wherever you work. I want to get paid for my time. Let's just be 100. And I got to pay my staff and I got to pay for my bills. So, nonetheless, you'll get value for your consultation fee, which is $225. If you decide to move forward, that is then deducted from your overall surgical cost. With that being said, please, please, please follow me on YouTube. I really appreciate it. Um, Appreciate all your support. You certainly have helped me out this year. I look forward to great things in 2025. Again, wishing everyone a Merry Christmas, a happy, healthy, prosperous 2025. Remember, if you want to change your vibe in 2025, a summer body is built in the winter. Until next time.